Hello and welcome to all our viewers here at Gold. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And here at Gold, we are in the midst of our preparation for the 2020 Online Tongue Tie Symposium here at Gold. And in the process for getting ready, we are also talking to our speakers here, what they are up to. And with me today is Dr. Cara Riek. Welcome, Dr. Riek.
Hi, thank you for having me. So excited to be here, Kristen.
Oh, it's wonderful to have you. And you've been with us at Gold before, and you're back here with us for popular demand. So it's lovely to have you
Oh,
here today.
yay. Awesome.
Great. So tell our listeners a little bit about the ones who don't know you yet. Uh, Tell them a little bit about yourself and where in the world are you?
Yeah, so I'm Cara Riek. I'm a family nurse practitioner and international board certified lactation consultant. I'm out in Scottsdale, Arizona. I have a booming practice out here, Arizona Breastfeeding Medicine and Wellness, where we really focus on taking care of moms and babies and helping families to meet their breastfeeding goals.
That's absolutely wonderful. Well, thank you for sharing that with us today. And I know we're still in the midst of COVID here in the United States, and you're in Arizona. That area was also kind of hard hit. How does that has that impacted your practice?
So we moms and babies still need to feed. So we have
Yeah.
remained open because it is important and really more important than ever to
Mm-hmm.
breastfeed your baby to help protect against this crazy virus.
Mm-hmm.
We have taken measures within the practice to extra cleaning in the rooms.
Mm-hmm.
We've kept our waiting room pretty empty by asking families to wait in their car before coming into our office. And then obviously it doesn't look like it now, but all of my staff are wearing masks
Right.
throughout the day, obviously, to protect everyone. And then we are taking temperatures just to be sure, to be sure, to be sure, to be sure that we're all
Mm-hmm.
safe. And so far, we've continued to help families in whatever context we can. We're also doing Zoom meetings. So we're meeting with people online
Great.
to help in whatever way we can. Zoom meetings are a little bit harder for breastfeeding because we can't put our hands in to touch, but
Mm-hmm.
we're trying to meet families where they're at and give them the support that they need.
And that's wonderful that you're doing this great work. And it's so, as you mentioned, especially in these times, so needed. You know, babies need to eat, and
Yes.
breast milk is just the best for them in
Yes.
these circumstances as well. And you mentioned Zoom meetings, and I can imagine you probably have to become a little creative there. As you mentioned, you cannot put your fingers in a baby's mouth, or
No.
so it's probably also a learning process for you, right?
It's a learning process. We do a lot of like, text messaging and sharing pictures and we do what we can. Like I said, we're here to meet families where they're at in their comfort level and COVID is scary. I mean, it
Mm-hmm.
scares me. And so we're just trying to do the very best we can to help everyone in whatever way we can.
Absolutely. And you are speaking for us at our tongue tie symposium. And tongue tie is a great topic. It's been such a hot topic in the field of lactation. And I'm not an IBCLC. I'm a midwife, as I mentioned
Mhm.
before. So, and for me, what we do to check for tongue ties in the newborn exam, of course. And but I've seen something which is really interesting to me. In old textbooks, we see that midwives often after birth, if they checked for the tongue tie, did a little cut with scissors or other little instruments there. We
Mhm.
don't, at least my state of Florida, we don't, that's out of scope of practice. So why do you think this is such a hot topic just recently? Is there more research available? Are we seeing more cases? Where is this coming from?
Well, I think it's probably multifactorial. I think
Mhm.
one, we probably are seeing more cases. I do work with a lot of midwives in my community that have been
Mhm.
doing this for 20 plus years, and I'm sure
Mm.
you can speak to this as well. That we're seeing more and more babies with tongue tie, and we can't
Mm.
really explain it. And so when you
Mm.
start to delve into the research, some of the research are saying that part of it is our change, at least in our Western diet. That back in the early 80s, we wanted to prevent spina bifida, cleft lip, cleft palate, so we added folic acid to our food source. And so
Mhm.
the point of that was to create more tissue, but then as a result, that every effect has an equal and opposite effect. So what we're seeing now is that we've helped to prevent or decrease the incidence of some of these spina bifida, cleft lips, cleft palate. But as a result of doing that, we're seeing an increase in tethered oral tissue. And
Mm.
in some sense, it makes sense to
Yeah.
me. I think there's also a huge genetic component to it that when you look in families, you can start to see um, more they weren't diagnosed. So if you didn't
Yeah.
know, you couldn't treat them. And so I would say, even in my practice as a family nurse practitioner, I also treat and correct adults and older children. And so
Mhm.
within families, we're seeing a connection.
Yeah. And this is so interesting that you mentioned that it's looking at families and corrections. I've done, since I became interested in the topic of tongue tie, I looked at that as well and looked around in my family and heard, when I listened to stories saying my aunt saying, "Oh, my cousin couldn't nurse because wasn't able to nurse," and I was thinking maybe that baby back then, 20, 30 years, whenever it was, had tongue ties. So we did a little game, and I look at everybody's tongue, and it's
Hmm.
just fascinating. And I'm sure you do the same, or even more so, to see what's going on there, because now the emphasis is much more on breastfeeding, right? So it is important that a tongue tie is diagnosed, and the baby can then have a good latch and feed.
Yes.
In previous decades, the easy solution then was just, oh, baby is
Hmm.
not nursing, baby is not eating, so here's the bottle, and that always works. So I think it is really fascinating to look at that as at different generations there as well. Uh,
Yeah, I 100% agree. I think that, as you know, and I talk about a lot in my practice about how we stopped looking for tongue ties back in the 50s because of the advent of the bottle and the formula. But
mhm.
if you really look in the medical literature, there were discussions about tongue tie revisions as early as the 1500s.
Yeah, exactly, exactly, and that's what I mean by those old textbooks. I mean, I have probably haven't seen a book from the 1500s, but like older books, out of
Mhm.
interest, I looked at, and there was like, yeah, there is a reference to tongue tie, which I thought was quite fascinating. Your presentation is actually on reattachment and re-release, and to me that is, when I saw the topic that you're presenting on, I was really excited because,
Yeah,
we don't hear much about that yet, right? And it's also, correct me if I'm wrong here, a little bit of a touchy subject, right? Because when we think of attachment and re-release, something comes to mind that we're thinking, what did the provider do wrong? Didn't they do the release right? Did the parents not follow up? What's going on? Was there no follow up? So there's a lot of questions that come up here right away, right? So tell us a little bit about what you will be talking about.
Yeah, so for me, I feel like reattachment is kind of the white elephant in the room. I think we
Mm,
all experience it. I think we all see it, but I think we don't discuss it.
mm,
And I think it happens really more often than a lot of us would like to admit or to even allow for. And as a release provider, it was something I started to track in my practice. Like another professional came to me and they were like, "Well, what is your reattachment rate, Cara?" And I said, I think, everyone says it's, between 5 and 10%. That must be true. And so they're like, "Well, everyone says that. So you really, I feel like that's not really the case." And I took it to heart. And I came back home and I was like, "Well, let me really start to contact previous patients and really see what reattachment is and see what their experience has been and how things have had." Because for me, we are IBCLC, so we do follow them for several months as they choose to be followed. Like, we don't really
mhm,
hunt people down. But as I started to call previous patients who didn't follow up with us, I started to realize that, my reattachment rate is probably closer to, I would say, 20 to 30%, which is
hmm,
not awful, but it's
hmm,
still, more than the 10% that we report. And so for me, I thought, why are we having these reattachment cases? And why are families not coming back to me in those cases where I don't know to tell me that's reattachment? And so some of these families would say that they felt like, "Oh, it was my fault. I didn't do the exercises." And some of them
mm,
went
mm,
on to another release provider because they felt like I didn't do a good job. And I was like, I think what's happening is that reattachment is a multifactorial issue. I think, and that's really what my presentation addresses. It's the multiple reasons why we do see reattachment. I think a big part of this is that we shouldn't blame anybody. That part
right.
of reattachment is really a product of the procedure that we are performing on infants. We don't have the ability to go in there and suture up these tongue ties, and so part of it is how the body heals. And so if we don't start having this conversation, at least among professionals, we
Hmm.
also need to be having these conversations with our patients to let them know that reattachment happens. And it's
Right.
not ideal and it's not perfect, but you have done nothing wrong. I have done nothing wrong. We have to work together to continue to help your baby to feed, and
Hmm.
that it's okay. It's
Yeah.
not, don't take this personally. I mean, if you want to blame me, I understand that because this is frustrating and this is really hard, but we're here to support you. We're here to help you. And if we start this conversation before we go into the release, I think the outcomes in the end are a lot better for everybody.
Absolutely, because information is key. I do also believe that many of the parents might not even be aware of this. Something can happen. They think, this procedure was done and now everything is well. And oh yeah, so it is really good information to have there also for the parents to know. And you're right, we don't talk about it enough. And I'm glad that you're presenting here at Gold. And probably, Dr. Rick, you are obviously excited also about what's going on in the chat during the live presentation, right? I can imagine we're going to have a lively discussion going on from our listeners there as well. And we're going to have
Awesome.
a live Q&A so we can collect all
Yeah.
these questions that
Yeah.
are coming up and have that there as well. And also something that is great, I got a little sneak peek, not of the presentation, but just of the setup. You have some great videos as well in the presentation.
Yes. Well, I really wanted to make this, to really educate people with what I've seen and what I've learned and start this conversation because this
Yeah.
is how we learn and this is how we grow. And so the more we interact with each other, the more that we share, the more that we come together, I truly believe the better we can do for our patients.
Absolutely. Well, thank you so much, Dr. Rick, for sitting down here with me and
Yeah.
talking about tongue tie and reattachment and about the topic here at the Tongue Tie Symposium of 2020. Thank you so much. It was such a joy
Awesome.
having you
Yeah,
here.
great talking to you. I look forward to on the presentation day.
Absolutely, us here too. And this is now for our listeners. This presentation by Dr. Rick is part of the Gold Online Tongue Tie Symposium of 2020. We have 2 full live days planned for you on September 14th and 15th. We have 10 presentations altogether. They're all live, but also recorded if you can't make the live. And you can either join the full symposium or pick a day of your choice. But trust me when I say this, go to and check out the program. And I know you want to be part of the full symposium here. And to do so, go to goldlearning.com. There you will find the full program of the Tongue Tie Symposium. Thank you, everyone, for participating and listening here and viewing here. Please leave some comments below or questions if you have any questions for us. And thank you one more time, Dr. Cara, Rick. And goodbye to everyone. Hope to see you at the
Bye.
symposium.
Thank you. Bye.